I want to thank you. Tyler asked me to be on call as a physician because we're getting behind the schedule, so I thank you. I'm used to being on call, and I appreciate just the opportunity to speak to you. So I'm coming from a different perspective from the rest of you. This has just been a great experience for me. I get out of my zone a little bit working with doctors and meeting with my patients to find out how you guys are thinking, and going to Arlington the other day and seeing how the city is planning has been such a great opportunity for me, and I learned, and from Jonah today too. So I think we can learn from Jonah and do that too. So our vision in the future is to be working with you to have healthy communities so we can have healthy people too. Now we have five strategies around that. I put them here too. One is to be able to measure vital signs of health. Now you all know about blood pressure and heart rate and respiratory rate and temperature, but I want to talk to you about vital signs for health and what we're doing to achieve that. Then we, of course, want to promote healthy behaviors. We want to create healthy environments with your help, too, like I mentioned, and monitor disease incidents around those healthy behaviors, and then spreading leading practices. So we've created a total health dashboard, and this wasn't easy because we weren't used to measuring these things and recording them. Things like alcohol use or tobacco use or BMI now. Every patient gets a BMI. You heard earlier this morning about exercise as a vital sign too. And then to correlate those type of behavior vital signs with incidence of diseases like diabetes or prediabetes. So I want to tell you a personal story first, then I'll tell you some stories at Kaiser. Is personally, I believe in vital signs. I talk to my patients about it, but 4 years ago I wasn't very healthy myself. So in 2009, my BMI was 34. I weighed about 220 pounds, and I did not exercise. I would tell my patients to exercise, but I wouldn't exercise. And I was on 2 medications, one for blood pressure and one for cholesterol. So what did I do? Our chairman, CEO, Mr. Halverson, was promoting walking, so I started walking, right? And after a couple months of walking, I said, hey, I'm going to sign up and walk a half marathon. And I did, and I finished it in about 3.5 hours. Wasn't very fast. But the next year I said, hey, I'm going to jog a half marathon. And I did, and I finished in about 2.5 hours. And then the next year I said, I'm going to run a half marathon, which I did in a little over 2 hours. So I went from not exercising at all over a 4-year period to getting better in shape. And then it's easier for me to talk to my patients. And then I repeated my vital signs, my vital signs of health. And you can see the numbers there. My BMI was down to 26, my weight 179. I'm exercising about 240 minutes a week, and I'm off my medications for both blood pressure and cholesterol. So next I want to tell you, vital signs are important for Kaiser, and as Bob mentioned today, we've been measuring exercise as a vital sign. And what did we find out? We find out that areas with high obesity rates have low exercise rates, and areas of low obesity rates have higher exercise rates. So we asked ourselves, could we increase exercise rates with education? And we found in Colorado that if patients went through a 9-week course, we could increase their exercise rates from 40 to 56%, and participants who finished the course, 83% of them lost weight. So next we said, could we use technology? And with technologists developing, we have a program we're working called Total Health Connect and Interchange. You know, one of the problems right now with all this technology, we can't get the information from the computer into electronic medical record. So we've been working on that. And so we set up a pilot called, here, look at social networking, the effect on that, with Fitlix technology to be able to download this information, and in a team competition setting. And we found out that participants who use social networking had exercise rates almost double of those of people with non-social working environment too. And we drilled down, Donna, we found out it was more important that the team competition on the social networking, that people could see what each other was doing. And that seemed to be a driver for that too. So this technology can be used to go to the primary care doctor so he can see how his group of patients is doing. He can see individual performance, and then he can also send them a secure message as far as how they're doing on their performance, congratulate them, encourage them to go the next step for others too. So I want to throw out here a big audacious goal in lieu of our next speaker, who I had a chance to talk to for a few minutes too, that I think it's really possible now to spread this out. So for example, if one physician was able to recruit 250 of his patients and ask them to walk 1 mile a day for a year, that group could walk almost 100,000 miles in a year. But if we took 10,000 primary care doctors like we have in Kaiser, asked them to do the same thing, we could, as a group, walk 1 billion miles by this time next year. So I ask you today to come walk with me as a physician, to engage your doctors to walk with you, to engage your doctors to try to recruit a number of his patients to walk. And hopefully together by this time next year, we could have walked 1 billion miles. Thank you very much.